Thanks for staying with us. October, as you probably know, is Breast Cancer Awareness Month. Every 3 minutes, a woman in the U.S. is diagnosed with breast cancer. That's a rate that many think is too high. And Dr. Jasmine Nabi is a medical oncologist at the Hall-Perrine Cancer Center, and she joins us today to talk more about different types of breast cancers. I think a lot of women just hear the word breast cancer and they think it's all the same, but there are a lot of different types. Can you tell us about them?
Sure. So the most common type is estrogen and progesterone receptor positive. So that means that the disease is stimulated or fueled by hormones. Okay. So we use anti-hormone treatments for that particular situation. And then there is HER2 positive breast cancer. That's where there's a growth promoting protein, and we use targeted therapy against that breast cancer. And there's also a triple negative breast cancer. That's the cancer that does not have any estrogen, progesterone receptors, or HER2. So we use these things to help us decide the best treatment.
And treatment's very different depending on what type you have as well.
Exactly.
What treatment options are available? I mean, obviously, I think everybody knows about the traditional chemotherapy and radiation, but what other options are there?
So when we think about treating breast cancer, we really have 3 main weapons. We have surgery, that's where a surgeon cuts out the disease. And then we have radiation, that's where we use beams of energy to treat cancer. And then we have chemotherapy, that's medicines to use treat cancer. So we're using a combination of those things for a particular situation, when we use different factors to help us decide what's the best combination.
Gotcha. Okay. Now, how is an individual's, you mentioned that you use all these different factors. How is it individual plans are put together in terms of treating it?
That's a very good question. So in terms of the factors that we kind of use into helping us, the type of breast cancer is obviously very important.
Right.
And then the stage, that means as the cancer advanced, has it gone into the lymph nodes? And that's where did the disease figure out not only how to grow in the breast, but did it go into the draining system? And then did it go into the lymph nodes? Did it go into the rest of the body? So the stage is also very important. And then we use individual factors such as a person's age. And then patients have certain preferences. So for example, for surgery, they can decide that they want a mastectomy to remove the entire breast versus a lumpectomy to have just part of the breast removed. So those are all decisions that go into figuring out what would be the best treatment.
And there's a lot of information out there, and somebody with a diagnosis may have a lot of questions. You're hosting a webinar later this week to talk about some of those things. Can you tell us a little bit more about that?
Yes, so this Thursday at noon, I'm doing a webinar to kind of give a broad overview of breast cancer and going into more detail about what we've just discussed about the different types of breast cancer and the treatment options.
Okay, and you can register and you can find that webinar by going to mercycare.org/live. And we should point out too, that's completely anonymous, right?
Correct. So if you want to submit questions, they can be typed in and completely anonymous.
So log on to that Thursday at noon. Dr. Nabi, thanks so much for coming in today. We appreciate you being here.